My name is Ahmed Kamel Abdelal, and I'm an interventional radiologist. I work in University of Texas at Houston, and I'm the chief of interventional radiology and the vice chair of radiology. And I treat a lot of cancer patients, so my subspecialty is interventional oncology. Interventional oncology is a subspecialty of radiology that is concerned with treatment of patients who have cancer. We do minimally invasive treatments for the cancer patients. That includes arterial therapies, where we go with a catheter into the arteries and inject certain substances that kill these tumors. And it also includes ablation, where we stick some needles into the tumors and then we either heat them or freeze them in order to kill them. I do a lot of procedures. My main focus is, like I said, on treatment of liver cancer. And so some of the procedures that I do for this includes radioembolization and ablation of these liver tumors. With radioembolization, we go with a very small catheter in the groin, and we make our way to the artery that supplies the liver, and then to the artery that supplies the tumor, and then we inject tiny little beads that has radiation material inside them. And these beads will find their way to the tumor, and they will radiate the tumor and kill it. In ablation, we go over the skin here with a small needle, and we direct that needle using image guidance, either by CT or ultrasound, and we'll place it accurately and precisely inside the tumor. And then we either heat the tumor to a degree that kills all the tumor cells, or we freeze it, which will also kill the tumor cells. So that's the difference. One of them is through the arteries, and the other one is through the skin. This is not a surgery, it's a minimally invasive procedure. There are no cuts. The only thing that the patient is left with is a very tiny little incision in his body, either in the groin or at the surface of the liver, which we don't even stitch or treat, or we just put like a bandage on it. Definitely this is very, very advantageous treatment for the patients. It's an outpatient treatment, so they come in, they get the treatment, they go home. There is no time that they have to spend at home recovering from major surgery that they sometimes undergo to treat these tumors. It's very convenient for them because they can function normally after the treatment. Plus, the outcomes of these treatments are actually one of the best for the treatment of certain lesions or certain tumors of the liver. I finished 100 of them here in Houston, but I have done a lot of radioembolization also in the other places that I worked in before I came here to Houston. It feels really great because it just aligns with my mission of treating these patients. I like to stand with patients who have cancer. I like to take care of them, and I really like to offer them, several treatments that we do, because I think, the type of treatments that we do, especially in palliative patients that have no cure, basically, I think it's very minimally invasive. It does not really affect their lifestyle, and it produces the effect that is very similar to other modalities of treatment that actually would affect their life and would sometimes make them bound to the bed, for some time, recovering from that treatment. Interventional radiology is a relatively new specialty, and we're trying to raise awareness for this specialty and the capabilities of this specialty. Interventional radiology has become a fundamental part of the algorithms for treatment of almost every disease now. We as physicians specializing in interventional radiology, unfortunately, are slightly rare compared to other specialties. So and that's why sometimes it's difficult to find an interventional radiologist compared to, for example, finding an internal medicine doctor. And that's why we try to also raise awareness of the capabilities of interventional radiologists and what they can offer for the treatment of several diseases, both for the medical community as well as the general public. If you really want to treat diseases the right way, it has to be a collaborative approach and a multidisciplinary approach. You cannot have that unless you have all the stakeholders in the room at the same time. That's why we have tumor board for cancer. This includes specialties like medical oncology, surgical oncology, interventional radiology, transplant, sometimes pathology, radiation oncology. So there's all these experts that are available in the room to discuss one patient and offer the best treatment for him. The main aim eventually is to move into personalized type of treatment So each patient is treated different than the other one based on his needs, based on his lifestyle, based on his support system that he has. So treatment should not be the same for every patient. It should be personalized. Say yes to hope.